Hello, I'm Marva Cope. I'm a clinical practice pharmacist and I'm also an independent prescriber. I think often patients will expect an antibiotic prescription because historically that's what they've seen and they've known from their parents and grandparents. But obviously it's now about educating those patients, informing them with the expected recovery time for that particular infection, especially if it is a respiratory tract infection, which is also self-limiting. And I think most importantly, often when patients are demanding prescriptions and they're quite adamant they need an antibiotic, there might be some underlying concerns that we need to address first. So we need to understand what is worrying you, what is concerning you, why do you think an antibiotic will make the difference, because then we'll be better placed to then educate the patient and informing them that it's okay to have a cough, for 3 weeks, providing of course there are any other comorbidities or red flags, and that would be, you're expected to clear and to clear that cough within that time. It is okay to have sinusitis for more than a week, and you might be able to manage that with normal analgesia. And I think once we're addressing the concern and we're addressing also the fact that the likelihood for these group of patients, when the risk is quite low, of developing serious conditions and serious infections is very, very low. And I think when we're spending that time in explaining that to the patients, I think the patient can make a better decision. They are more informed, and the likelihood here is that they're not going to reconsult in the future for the same condition.